UPMC has really redefined the delivery of medicine in the community setting. And we have the ability now, through their guidance and their expertise, to deliver a level of care and best practice care that a normal community hospital can't have.
We developed a philosophy of philanthropy, which would guide our decisions in how we spend the money. And in doing that, we said, we already have a fabulous hospital. We said, you know what we want to do is we want to spend money on things that are above and beyond. We wanted to go from good to great.
When I thought about where I wanted to be to finish out the rest of my career, I wanted to be back home. And so the opportunity here at UPMC Northwest was a perfect opportunity for me from many perspectives, from the group I get to practice with, the affiliation, of course, with UPMC, but also the community and the area as a whole.
Our physicians and our staff are the lifeblood of the organization, so getting highly trained and highly skilled physicians to come to UPMC Northwest is probably my proudest achievement, just because they're so important to who we are. We're about halfway through a significant construction project that's an $8 million project where we're upgrading all of our oncology equipment and area. It will include a new linear accelerator, as well as doubling the number of infusion chairs that we have available. Being affiliated with Hillman provides us with clinical pathways that have been established by some of the best oncology physicians in the country.
Cancer is difficult. It's a strain financially, emotionally, and on a patient and their family. So to be able to come 10 or 15 minutes to their appointments and get the same care they could get somewhere else, traveling an hour plus in big heavy traffic in a big city, is really important. One of the biggest barriers for patients sometimes to get cancer care in general is access. So being able to access it close to home is very important.
We're really fortunate here at the foundation that we have individuals in the community who want to see the hospital thrive and who are interested in seeing the community thrive. And we had a couple who came to the foundation who have experienced firsthand the telemedicine program. The result of that was the funding for the tele-ICU cart.
We're very proud that we have the most robust telemedicine program at UPMC, and recently I heard a statistic that UPMC has done 6,000 telemedicine visits to patients since the inception of the program. 4,000 of the 6,000 have been here at UPMC Northwest.
The behavioral health murals have proven to be very beneficial to our patients. They've created opportunities for the more traditional treatments to take hold and to be retained.
And if you also take a look at the mural, what you can find also too is throughout the scenery you can see it emulates your own life. You may come across a bridge, you may come across an open field, and in those situations it mimics life. And so they've become great learning tools.
Our foundation are just the best partners, and they are really focused on allowing us to provide care that normally wouldn't be available in a community setting. We're lucky. Blue light cystoscopy is a new piece of equipment and technology that's available that has really revolutionized the care of bladder patients. And when a physician is able to use this technology, it is able to identify the cancer cells in such a marked difference that they're able to radically improve their ability to treat the disease.
Typically, a bladder tumor would be treated endoscopically without actually making an incision in the abdomen, which is great. The exciting part about the blue light is that basically it places a filter to be able to visualize things that we can't always necessarily see with our own naked eye. With that narrowband imaging technology, we can see where tumors might be starting that we really would appreciate under white light, and be able to treat those areas almost before the tumor actually kind of sprouts out.
The blue light was a project that came to us that obviously was a very expensive project, not one that we went into lightly. And so we worked directly with the hospital to identify those very important needs that are going to make the biggest impact here in our area.
The blue light technology sees it all. We were committed. We thought, you know what, bladder cancer is very, very common. It's common in our area. The number of patients that can be treated like this was significant. So we were happy that we were able to have the resources to be able to respond to that. It's a good thing. It's actually one of our good to great things.
I woke up one night about 2 o'clock in the morning, had to go to the restroom. Went in the bathroom to go to the restroom, couldn't go. Which I didn't think anything of it. And then I wiped and there was blood. So I woke my husband up. It's about 3 o'clock in the morning. We go to the emergency room and they catheterized me. At 6 o'clock she came back in and she said, "We're sending you home. But as soon as the doctor's office opens in the morning, you need to call the doctor."
Bonnie is our patient that we had met. Unfortunately, she was diagnosed with a bladder tumor, which was sort of right at the connection between the ureter from her right kidney to the bladder.
I was not worried. They were all so positive on, look, this is all we have to do. We can do this, 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 and this will be the result. And that's what we did. We did this, 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 and this, and it turned out great. So far, knock on wood, it's still good.
Bonnie would be a very good example of how blue light cystoscopy would benefit your patient population. I think she had one little tiny recurrence that was picked up, with the blue light cystoscopy, and we literally just, zapped it right there under local anesthesia, and she's been fine ever since.
They may not think it makes a difference, but small things like that, and those machines are costly, I'm sure. It makes a big difference in everyone's life, in our treatment. Just thank you.
I think for us, for the future, we're looking to serve more, to serve better. Our mission is to provide hope, healing, and access to quality health care here at Northwest.
It's just a remarkable achievement in knowing that our patients from an hour radius are coming here and getting that care and choosing to come here speaks volumes about the power of UPMC, as well as what we're able to do on a local basis.